Hello everyone, welcome to HIM 225. This is a continuation of the lecture covering the end of chapter 22 in your textbook and specifically covering the chapter review questions. In the previous lecture, I was talking about question number 9 in your homework assignment. And just to review, this is a patient that's admitted at 33 weeks and she has a twin pregnancy. She spontaneously delivers live-born twins, and then a few weeks after delivery she hemorrhages due to uterine atony. Now the first thing that we have to do is code the fact that this is preterm labor. So as a reminder, you're going to go to pregnancy complicated by preterm labor. She did deliver and she was in the 3rd trimester. Now, the one thing I want to point out to you with this, and I know I'm giving you the answer, but I'm not, but I know this is going to be confusing to you, is that both of the twins were impacted by this. And this particular question has a 7th character that designates the fetus. And so in this instance, we know that we have fetus 1 and we have fetus 2 because this patient is pregnant. And then you're also going to code the fact that this is a twin pregnancy. And the thing about coding this twin pregnancy is that you have no idea how many sacs or how many placentas there are. So you're not going to be able to get down to that level of specificity in this coding. Then you also have to code the fact that this is a postpartum hemorrhage, and this was after the delivery of the placenta. So you can look up hemorrhage postpartum, or you can go to delivery complicated by hemorrhage postpartum. And that reflects that she also had the atonic uterus. This was a manually assisted delivery, regardless of how many diagnosis codes we have. There is only one procedure code. So you actually have 4 diagnosis codes for this. The preterm labor for each fetus, the fact that it was a twin pregnancy, and the postpartum hemorrhage. You also need your Z code for the week's gestation, your Z code for twins, both live-born, and then your procedure code. So you have 4 diagnosis codes, 2 Z codes, and then your procedure code. Now for question number 11, this patient was treated for right sprained wrist. Incidentally, the patient is 10 weeks pregnant. So remember, we have some very specific wording here about this wrist and whether or not it was complicating the pregnancy. So here you have one diagnosis code, you have a Z code, and then there is an external cause code for the accident. Now for number 13, the patient is admitted for hyperemesis gravidarum. The patient is 12 weeks pregnant. For number 13, you have 2 codes. You have one diagnosis code, and then you have the Z code for the week's gestation. For number 15, the patient's 16 weeks pregnant. Her condition is complicated by diabetes mellitus type 2, which is uncontrolled. So this is not gestational diabetes. So in this instance, you have 2 diagnosis codes, and then you have a Z code for her week's gestation. So your principal diagnosis code will, of course, be her pregnancy complicated by diabetes type 2 code, and then you'll have the code for the diabetes. Question number 17. Patient is 19 weeks pregnant and has hypothyroidism. So you're going to have, remember, you're going to have a pregnancy code, a code from chapter 15 as your principal diagnosis code. Then, of course, you will also have the code for the hypothyroidism and the week's gestation. For number 19, this is a UTI in a patient who is 30 weeks pregnant. For this, you only have two codes. You have a diagnosis code from Chapter 15, and then you have a week's gestation code. For number 21, we have a 15-year-old pregnant female who presents at 39 weeks in active labor. She has no past history except for several bouts of asthma as a toddler. She has an uncomplicated delivery of a healthy boy. Now, your first thought might be to code the fact that she is a young prima gravida because we have a guideline for that. But that young prima gravida code is only used in the prenatal period. So I'm going to tell you that for number 21, even though this is a 15-year-old, this code meets the description for a normal delivery. So you have one diagnosis code, you have two Z codes, and then you have your procedure code. Now for number 23. This patient is 40 weeks pregnant. The physician documents that chlamydia was discovered early in the pregnancy. She is now negative. She has a spontaneous vaginal delivery of an 8-pound baby girl. So again, this is just a normal vaginal delivery. So you have one diagnosis codes, two Z codes, and a procedure code. And then number 25, the patient's admitted to the hospital 1 week postpartum with a high fever. The physician documents endometritis. She's treated with IV antibiotics. Well, we're not going to code that because it's an inpatient status. So for number 25, there is one code. If you have any questions, please contact your instructor, and that will conclude the lectures for Chapter 9.